I'll introduce myself quickly first, and then Michelle, and then you can start going in.
Okay.
Okay, we are ready. Hi, everybody. Welcome to the first in our hopefully long series of FaceTime Lives from Atlas's Mental Health Advisory Committee. I'm Jennifer Kohler. I am one of the founders and president of Atlas Assistance Dogs, and really excited to be here today. Michelle, you want to introduce yourself?
Yeah, my name is Michelle DeRosa. I'm a licensed professional counselor in the state of Virginia and Maryland. I'm also a national certified counselor, as well as a board approved clinical supervisor in the state of Virginia. My clinical focus is in a university setting as well as private practice, and I also serve as a mental health consultant with Atlas. My clinical focus is trauma, PTSD, OCD, anxiety, and disability.
And Sarah?
Hi, everyone. My name is Sarah Pellizzari. I'm a licensed clinical social worker and I work in Colorado Springs, Colorado. I'm also a professional dog trainer. I'm certified through Karen Pryor Academy and have been training since 2017 and been in the social work field for much longer than that. My primary focus is actually working with children and adolescents. I volunteered for Atlas for a good while now at different capacities. So I was a team facilitator at one point and then moved on to the mental health committee, and which is relatively new. So we are going to be doing these FaceTime live events every single month, the last Monday of the month at the same time, just to give a little bit of a highlight on different topics and subjects that we think could be valuable to the Atlas community, both service dog trainers and the clients. So this is Post-Traumatic Stress Disorder Awareness Month in June. So we're highlighting trauma today in our talk. Next month, we're actually going to talk about boundaries. So we will have some really good content next month as well. So today, we thought we would just talk in kind of a relaxed format about trauma, why we think it's important as a service dog agency to have these conversations. And between myself and Michelle, maybe share a little bit of our clinical expertise just to give a little bit of background so people can maybe understand how trauma can affect us in different ways, but also different strategies that we might employ while we're working in the community. Whether you are a client and you have a service dog and you just want some help around navigating difficult situations, or you're a service dog trainer and you would like to think about different ways to help your clients and to support your client. So most of us know, what trauma is. We actually just had a blog topic out on trauma. So we encourage you to check out the Atlas blog to get a little bit of background. If you aren't as familiar with post-traumatic stress disorder, we do give an overview of that topic in our blog to give you an idea of what PTSD is and some symptomology or symptoms that go with that you might see in people. And also different ideas like we're going to touch on today on how to support both clients and service dog trainers when you are navigating some of the difficult things that might come up. So, with that being said, I'm not really sure where we'd like to start today. In terms of trauma, it's a big subject to dig into.
Yeah.
There is a lot that goes into the subject. I feel like right now, just kind of in the world, there is a lot of traumatic stress. So there's a
Mhm.
lot happening, but also people have just endured a lot more in the past, 5 to 10 years than in a lot of decades before. So we're seeing more trauma symptoms. We're seeing people have more mental health concerns. And I think part of that too is that we're becoming more comfortable having these conversations. So we are bringing trauma into the light a lot more than we used to. So that is a definite positive of talking about trauma now.
Mhm.
So I don't know if Michelle would like to hop in and share anything about maybe
Yeah.
her perception of trauma in the world right now and how that might be
Yeah.
affecting people.
For sure. I also, that's a really good point, Sarah. And I forgot to mention in my intro that how I am affiliated with Atlas. So I'll start kind of with that because that it also, really highlights or talks about where my experiences, why I went into trauma therapy and all of that. But how I got with Atlas is I was a client of Atlas. So I had a service dog for 10 years. And one of my service dog's primary tasks was to help with a trauma diagnosis and to help me kind of navigate some of the issues and disabilities that I had. So I can pull in from that experience as well as kind of what Sarah was saying from a clinical background. We absolutely are seeing a lot of trauma responses. In the world, I work in a university setting as well as a private practice. And as a clinician, yeah, we have diagnoses of like post-traumatic stress or acute stress disorder, or now we're growing evidence about complex post-traumatic stress. And these are all just kind of fancy labels that really talk about what trauma is. And trauma is how an individual experiences an event that could be a wide range of events, such as a car crash or a war or a pandemic or things like that. And trauma is really categorized by how the individual reacts to or is impacted by those things. So when we're talking about it clinically, you could have someone who has a wide range of responses. So someone who might undergo the same traumatic event like a pandemic and respond to that in a more resilient manner or in a way that really doesn't impact their life than you might have someone who has the same exact experience whose whole life is turned around. So who experiences hypervigilance. And Sarah mentioned that on the blog, we really do break down, Sarah does a great job of breaking down what trauma is and some trauma symptoms that are very common. So you heard me mention like hypervigilance or emotional avoidance or isolation or changes in how we interact with the world. So we do see that as clinicians a lot right now as people are trying to get back on track or their lives back on track from a collective trauma experience with the pandemic. But there's also things that are happening in the world that are impacting from the day-to-day basis. So something that we were talking about today is, yeah, understanding traumatic stress, but also how service dogs can help with post-traumatic stress or with traumatic stress. And I mentioned a little bit about, and Sarah absolutely can jump in as well as Jennifer about from like the training perspective, but from clinical perspective, psychological service dogs can be really amazing tools and to help our clients who are disabled by post-traumatic stress to gain independence, to gain empowerment, to really bolster their resiliency skills. And when I say resiliency skills, I mean the ability to have stressful things around them happen, but instead of their body kind of going into that fight or flight freeze mode, to be able to slow their body's reactions down and engage with the world around them, utilizing their coping skills, utilizing the service dog, so that they can be present and interact with the world around them. So I don't know, Sarah, if you wanted to jump in from a trainer perspective about psychological service dogs in particular.
Yeah,
And
absolutely.
yeah.
Yes. And so I wanted to backtrack a little bit. I really appreciate how Michelle mentioned that trauma, results in different symptoms and kind of describe those a little bit for us too. And so one thing that I would like for people to keep in mind when we're talking about trauma is how it literally restructures your brain and can change your brain chemistry. So there is a lot going on that those symptoms are coming from. So that's why having that just over overarching understanding of trauma can be really, really helpful. Sometimes when we see some of these symptoms, if we don't understand trauma, whether it's not understanding our own trauma or not understanding the symptoms in somebody else, then it can feel really confusing. We're like, why do people act, the way that they're acting? Like, why is this going on? And so really making that part of like normative culture to understand trauma is important. That will help us normalize psychiatric service dogs.
Yeah.
I think a big piece of the disconnect can be that, psychiatric illnesses can be invisible disabilities. So it may not be something that we see that we would see with a physical disability where it's really apparent to other people. So we're dealing with something that's a little bit of something that can be hard to describe to other people if they have never experienced it before themselves or known somebody who has had a psychiatric illness. That these are disabling conditions. So to keep that in
Yes.
mind, and
Yeah.
also that psychiatric service dogs are a special class of service dogs. So they are legitimate service dogs and they are task trained. So they're trained to, have different cues available to their handler in order to mitigate some of the stressful symptoms that come up and to help bring
Yeah.
that person back to baseline. So yes, like as Michelle was saying, they're highly valuable in the service dog world and really helping people to understand the psychiatric service dog is different than, emotional support animal. That's been, I think, a piece that people don't quite grasp a lot of the time. So those are two very different classes, and they can serve both purposes, right? A psychiatric service dog can also provide emotional support to their handler, but that they are actually task trained. So that is
Yeah.
a difference. And, when you're going through a service dog agency such as Atlas, where we're helping you to train, be able to pass a public access test. And so your dog is familiar with those public environments. So keeping that in mind is a difference too. So that confusion tends to run around, I think, a lot in the training world. And also in the therapy world, you can have a therapist who, unlike Michelle and I, they may not understand the difference. You may have a
Right. Yeah.
psychiatrist who may not understand the difference. And so really helping those providers to understand that psychiatric service dogs are, legitimate service dogs, they are
Mhm.
trained, that they are providing a service for their handler is really an important thing to highlight. And I know that we have, we try to help educate providers in that regard too, and organizations so that you can better understand this special class of service dogs. So,
Yeah.
And I think
Okay.
one thing to add
Yeah.
to what you're just saying of, these being task trained dogs and what trauma is, and I also have a psychiatric service dog.
Mhm.
And is sort of the question we get a lot from people is, am I bad enough? Do I
Mm.
need this? Do I deserve this? Is my trauma severe enough? Is my
Yeah.
mental health condition severe enough? And whether under the American with Disabilities Act, the definition of a disability is very different than the diagnostic definition you might have from your provider. So, in American with
Mhm.
Disabilities Act, it's something that significantly impacts your life day to day. Now, can
Mhm.
I function without my service dog? Most of the time, yes. Do I function a lot better with him present and helping? Does that make me more capable to do more things? Absolutely. So just because you sometimes are just fine without your service dog, or may choose for whatever reason not to have them with you,
Yeah.
doesn't mean that a service dog wouldn't benefit you or that you don't quote unquote qualify for a service dog. Because
Yeah.
anybody who, and it's to the point of that trauma being in the eye of the beholder, so
Yeah.
is disability and its impacts in the case of the American Disabilities Act and the
Yeah.
case for service dogs. And so, kind of helping remind people that you're not having to compare yourself to somebody else. It's really about how it impacts you. And it may not be how it impacts you in every environment. It could just be certain
Mhm.
environments that you need support from that dog. And so giving yourself room to be curious of, maybe a psychiatric service dog could help me or
Mhm.
somebody you know. It doesn't have to mean that you're completely and utterly debilitated all the
Yeah.
time by your condition. Ideally, it's helping you have a fuller life.
Yeah. It's a really good point. And I touched on a little bit that trauma is subjective. So I gave some examples, maybe not in the clearest way, that's two people can experience the same quote unquote traumatic event and walk away from that. Two different perceptions, two different brain chemistries. Sarah talked about the brain changes, the body can change. Trauma is subjective. Common causes, we can include combat, sexual violence, natural disasters, but it can impact a lot of different areas that Jennifer was just talking about, that the ADA regards as areas of disability. So emotional regulation, memory, relationships, physical health, daily functioning, being able to go to work, eat, sleep, take care of yourself. Those are all the areas that as a clinician, when we're talking about areas of disability, and as the ADA is determining, that's what they're looking at. And trauma responses, as Sarah, you talked about the stigmatization, how people can often, there's a lot of gray areas of people not really understanding, because trauma can look so different to each person. And Jennifer, you also mentioned people feeling not sick enough or not looking traumatized or whatever that might mean or look like. Trauma responses are not overreactions. They're survival strategies. So when we're talking about traumatic stress, I like to sometimes say that trauma responses are normal responses to someone experiencing an abnormal event. Or a traumatic event. Now, the way that our protective and survival strategies can sometimes get stuck, even well past the threat. And that's when our lives kind of our survival reactions allow our lives, or have our lives, get smaller and smaller and smaller, where we do have those symptoms of trauma and stress, such as our fight or flight system, our nervous system really gets stuck in those spaces. But it can be very difficult for others to know that, to see that, because as we've talked about invisible disabilities, but I think that's a really good point, that many people, and Sarah, you can speak to this too, a lot of trauma treatment is about psychoeducation, about exactly what we're talking about, validating someone's story and someone's instances and experiences, and really like going on the journey and sharing with them, this is what happens to your body when you undergo trauma. This is what happens to someone who maybe their body doesn't get stuck in that. And this is what you're going through. And so all of these things are very validated, and bringing in treatment can look like having a psychological service dog, should you meet the definition of disability, as Jennifer was talking about, and you meet it's a good match for you in what kind of treatment goals that you're looking for.
I think some of the, recognizing with those treatment goals, some of the things that dogs can do, dogs are always adjunctive therapy, right? They're never to be relied on as your primary therapy. They are living beings who have their own needs. But things like deep pressure therapy, helping guide somebody away if they're starting to have a panic attack, helping create some space around them, waking them from nightmares. Sometimes when I have a panic disorder, sometimes when you're in that situation, you just feel such complete lack of control. And having a dog with some of these tasks can help get you moving again, can get you out of a space that's not feeling safe for you, can give you a sense of just safety and autonomy, and ability to function. And so, really recognizing those changes in your body and then helping you control those symptoms or mitigate those symptoms, even if it's just to help you get to a different location where you feel safer to experience them. So those are just some examples of what a psychiatric service dog can do. And Sarah, I don't know, do you want to talk a little bit about, and I can speak to this too, but being a dog trainer, working with somebody training psychiatric tasks is challenging, or can be. Do you want to talk a little bit about kind of some of what we experience there?
Absolutely. And I'm really glad, Jen, you painted that picture of, how a psychiatric service dog can be helpful to their handler. I think that's really important. And also just wanted to highlight again, Michelle, just really, we're trying to destigmatize not just psychiatric service dogs, but mental health, right? And how a lot of times people are scared off because we really do have a medical model that we lean on, in Western society, and that's kind of how it's been for a really long time. And so people can feel scared, or they can feel ashamed, and maybe not have the family support or the peer support that they really need to have to feel like they have, the courage to deal with and get help for the mental health issues that they're experiencing. So I really appreciate that both of you talked on those points. I think in terms of working with clients, I think, I stand from a sort of a unique perspective that, I have, the trauma and the crisis training under my belt, so that is something that's just, I'm always kind of assessing and looking, and coming from a world where I'm just fascinated with behavior like that. It just all makes sense to me that we're looking at, our clients' behavior, our dog's behavior, and we're kind of putting those things together to help them the best way possible. But it is kind of dually challenging in a way, because you're as a service dog trainer, you're helping your human client in a way that you're trying to understand, well, what kind of supports might they need if we go out in public, or, what might be some of the concerns that they have, asking those questions, like what might be some things that would be potentially triggering, meaning, emotionally triggering, if we were to encounter something in a public environment, or something that might be a trauma trigger that we might need to be aware of, and maybe have a little bit of preemptive planning that we might be able to work through that together. Is that we have a graceful exit of some kind in a public situation, or what would be the best thing to help that person cope through that situation? Do they need some space? Do they need to maybe, have the opportunity to go somewhere quieter and, do some deep breathing? And then also understanding, the dog, I think the goodness of fit has to be kind of extra special with the dog and handler. I think in those situations too, is that you have a dog that maybe is a little bit more attuned to like the emotional piece of that. So some dogs tend to be a little bit more sensitive to what's happening with their handler, and they can pick up on those emotions. And so having the right match, I think, is really important too for a person who is looking for a psychiatric service dog to help them. Um, so it's not just, having the dog trained to do different things, but also having a dog that's maybe a little bit more finely tuned and bonded with their handler in a different way. I think that that can be really helpful too. Some of the challenges that might come up, we talk a little bit about this in the blog post as well, but there can be emergency situations that might come up if you're dealing with a mental health condition. So there might be times when you do need to get crisis support, when you do need to go to the hospital. Um, and in those instances, talking through from a trainer perspective with your client of, do we have a plan for, what happens to your dog in those situations? If you, I know just from experience, like with, service dogs and like inpatient hospitals, I think it's widely variable, like in what is allowed and not allowed. But really talking about that ahead of time, I think, is so valuable, so that there's not this, shock of like, oh, well, maybe I can't bring my dog into this situation. So, like, how am I going to cope without the dog there, as the client? And also, what's going to happen to my dog in that interim period? So, some emergency planning, and just having those conversations, and just approaching as a way of like, this may or may not happen, but at least we've talked about it. And also just being familiar again with what other supports might be available for that person when they need them, whether that is, friends or family, or, some type of community supports that they have involved, and I can understand that from the client perspective, they may only be willing to share, certain things, and they may only be comfortable with disclosing so much to their service dog handler. But I think from the, or for trainer rather, but I think from the trainer perspective, just really being open to having those conversations, and, showing curiosity and respecting their boundaries, I think is super important. So
And I think one thing, as you brought up emergency, what that really made me think of too is asking someone what actually is an emergency for them.
Mm.
Because it may be perfectly okay for them to have a panic attack, to sit down breathing, to for people that may have a seizure disorder. It is not necessarily an emergency for somebody to experience something that is part of their normal life. And so really understanding what is an emergency and what's not, and what do you want me to do, and where do you want me just to leave you alone. or help find a space for you to just recover. Because a lot of cases, especially for people with chronic illness and with invisible disabilities, the ER is not a welcoming place and is not a place we get validated for what we're going through. And so, because we don't necessarily fit a medical model as well, or at least visually don't. And so I do think as part of the planning of what do you do in emergency, also verifying what is actually an emergency. And being ethically willing at Atlas, all of our team facilitators, our volunteers that work with our clients are trained and understand that if they feel a person's life is in danger, they are required to escalate that. They may not leave the client and have the client say, no, I'm okay, don't call somebody. That is our ethical responsibility. And I would encourage you also, as if you're in the position of a trainer, to, have that plan. Who do you call? And as a client, please understand, we may make that choice if we truly feel your life is at risk. And to understand that that's not trying to take away your choice, but it's doing what we feel is just ethically necessary.
Yeah, and I think I would just add to that too, is, as a trainer, we don't expect a trainer to know how to assess, a mental health crisis, right? So even if it's just, the client says something and you're just feeling like, ooh, I'm not so sure, are they really okay? It is okay to call a crisis support line,
Yeah.
kind of walk through maybe some of those questions, or just call and have the client talk to them.
Yeah.
Get the extra help you need. You don't need to feel like you're put into a situation where you need to assess whether or not that client is or is not safe, because even I know that Michelle and I can speak to, that can be a really hard thing to assess for
Yeah.
people. It can be, very multifaceted, and we're all very different as humans. And like Jen was alluding to earlier, an emergency for one person may not be the same thing for another person. So
Yeah.
just knowing that there are support lines out there, even if it's just, so I was going to say, even if it's just reaching out and calling 911, the only thing I would say to that is we are getting better with having like some emergency officials have mental health, clinicians with them. So I think that's been really helpful. But just knowing, those are people that are trained to weed out the situation a little bit more.
Yeah.
So don't, be afraid to take that extra step if you feel like it will keep somebody safe, or at least, find out and make sure that they are safe.
Yeah.
And I think one thing that's interesting as a trainer, working with people with trauma, and especially where there may be significant social anxiety, is understanding doing the practice with their dog can be very, very challenging. And the very work they need to do to get their dog exposure and experience for public access work could be in direct conflict with exactly what their symptoms are and what they're struggling with. And
Which is, so sorry, not
go
me
ahead.
to.
Go for it.
I was going to say that's kind of, as a clinician, a really beautiful part about integrating psychological service dogs into treatment, is that piece that is a built-in exposure. And when you have the work with a clinician to kind of help a client, helps a service dog handler or a service dog handler in training go through that, that can be such an like rich area to work through. And as someone who, has both the clinician aspect, and then my service dog, Samson, when I had him for the 10 years, that was like a huge part of my growth is, oh no, the things we have to do to become a service dog team directly bring the heat of leaving the house, exposing myself. And because I had this greater goal of, okay, I need Samson to be trained to utilize these tasks. We have this trainer there. So that's kind of, to me as a clinician on the opposite side now, I'm like, man, that's such good work. And if you have a clinician or a therapist or a mental health provider who's able to work with you on that and incorporate those things into treatment goals. Hey, I have this goal with my trainer that we're going to be going to the mall and we're going to be learning how to do these tasks, and being it with people is just so overwhelming, but I'm trying to teach this dog with the trainer. That's great example of having a therapist come and be like, all right, let's bolster up some of those grounding skills for you. Let's take it slow. Let's work on our trauma treatment and the diffusion of that. And then as a client, you can communicate to your trainers, hey, I'm undergoing this treatment. I'm advocating for myself that when we are going to this mall or when these trauma triggers do come up, because I recognize I'm training to help reduce my symptoms of disability, but I'm also having to trigger myself, having to be willingly to live life and live the life I want to live. I'm willingly going through these exposures, having the trainer be aware of the different areas that you might need some trauma-informed care, like Sarah mentioned, and Jennifer mentioned, of taking a break. Okay, I'm at a 0 out of 10, I'm at an 8 right now. And I just need to go somewhere quiet to get myself back down, utilize the dog, of the other things that are being trained, maybe deep pressure therapy. But you don't have to flood yourself, just like we don't want to flood the dog in training. You as clients don't have to necessarily flood yourselves in order to white knuckle it to, yes, I have my service dog trained. This can be a great opportunity for your own recovery and care and ongoing therapy.
And I think it's a really important point for us as trainers to recognize that our clients are trying to please us. And
Yeah.
our clients are trying to be successful with us. And so even if you ask, do you need a break? It is very common for people, as Michelle said, to white knuckle it through, suck it up, and then collapse when they get home. So as a trainer, one of the things I love to do is say, you know what, I could use a break right now. It's kind of loud or noisy. I need to go sit down. Put it on yourself. Just say, you know, I could use some water. Why don't we go sit out here? Or you see, you know, use the dog as an excuse, but make it easy for them and put in those plan breaks. And also recognizing that people may need a little structure of help, that to say to someone, well, I want you to go out and do some public access work in a grocery store today, may feel insurmountable, versus saying, I want you today to go walk in the door, walk to the end of one aisle, turn around and walk out.
Mm.
Giving something manageable, that's small pieces that someone can focus on. Or today, I just want you to go sit in the parking lot with your car with the door open with your dog and watch people move around in the parking lot for 15 minutes.
Yes,
It
that's
could be,
brilliant. That's a lot of what we do with gradual exposure in our clients'
Yeah.
therapy. So really you're painting the same picture, Jen. And I think too, I was going to piggyback off of something you were saying there. When you're talking about, you know, giving these pieces that you're breaking down, like small goals, also it's very value added just to check in with your client every time, you know, you're going to meet with them. And we use the spoons analogy, which we talk about in the blog. And maybe even explaining that to a client, you know, having them watch the video, and then your check-in could be, well, how many spoons do you have right now? You know, and then kind of giving that as a little bit of a benchmark throughout your training session too. And like, I really like the fact that you said, as a trainer, you can paint the picture of normalizing taking those breaks.
Mhm.
Just really being sensitive to the value of that. And it normalizes, you know, self-care too. It really does. And I think that's something we really need to reinforce when we're working with anybody, right? With anyone. And I think in any capacity is it is okay to take breaks. Training is not linear, right? Like training is a popcorn of what it looks like from one day to the next. And some days you may not be able to train, and that's okay. Some days you might be able to do 5 minutes. You know, there might be a good day when, you know, you get in a 20-minute session, but to not have the expectation either as a trainer or a client that it's going to look like a certain way every time. And just going with that organic flow of like what a training session can look like. And there's so much value from saying, hey, like this, I'm really tired today. So instead of training anymore, let's go take a break. Let's go sit on a bench, and maybe we can talk about a little bit about like what made today more tiring, right? Like not saying have a therapy session, but just a little bit of information, like what about today was harder. And that reinforces, you know, looking at our environment, looking at how we're feeling that day, you know, physically, mentally, the whole picture, and just kind of understanding, well, what may have been different today that wasn't there last time that is valuable to acknowledge. Like, it doesn't mean that it was a waste of time to have that session. It's actually the opposite. Like, it's giving you so much information, and that will help you, crafting. I think the more self-aware we are as humans, like the better outcomes we can have for ourselves, right? The better we are going to feel and the better we are going to function if we're just really sensitive to how we're doing. So,
Yeah.
And I think one thing that's important to be aware of, and we don't talk about it so much in this blog, but that we're complex beings, and we ourselves as the dog trainer may also have experienced trauma. We may have experienced something very similar to our clients, and working through something with them may also be triggering for us.
that's such a good point. That's such a
And
good point.
so recognizing, giving yourself that space too, and yourself that
Mhm.
self-care, maybe afterward or before, um, and that people have lots of stuff going on. So they may have a mental health condition. They may also have a physical condition, and that may be a waxing and waning condition. And how that's doing can have really direct impacts on your capacity and what your tolerance is, in terms of stress that day. And so I think it's something else as trainers to be aware that we are in a human service, compassion driven field.
Absolutely.
And next month's blog and topic is going to be on boundaries, which is really
Yes.
important because it's really easy to not have good boundaries.
Mhm.
And that can really cause a lot more trauma, honestly, for everybody.
Yeah.
And so I think just recognizing also how the impact you can have on you. And even if you don't have the same kind of traumatic experience or don't consider yourself someone who's experienced trauma, you can still, it's called secondhand trauma or vicarious trauma. It is scientifically proven that your body can have physical symptoms similar to the person who had the firsthand trauma by you being with them and experiencing what they're going through. And
Right. Or even
so,
hearing a story, hearing their
Mhm.
story. And,
Mhm.
sometimes you pointed out a really good point, Jen, is sometimes as trainers, most people have had some type of trauma in their lives, right? Like something. And as trainers, we may be aware of our trauma triggers, but we may not if we haven't really given a lot of, deep thought to that or, had therapy around it. And not everybody has, right? And not everybody is at that point, but to realize, what are your own triggers and understanding as a trainer, like when do you need to have more self-care? Boundaries are really difficult, especially when, everything feels like, okay, well, it's coming from a good place. So I'm glad that we have that as our next topic because I think that that is, it gets really sticky. Boundaries are very
Yeah.
sticky and vicarious trauma is absolutely real. It's something that happens a lot in, the humane world and the training world and animal care. Absolutely. So, when you're working as a service dog trainer, there's the animal care aspect and the animal welfare, but there's also the human welfare too. So those components together, it's almost like you're taking on double of, maybe what you normally would in maybe a setting as just, working with people or a setting just working with
Yeah.
dogs. So that
and I
is a
could,
really good point.
and I can speak to from the trainer perspective and not being a mental health professional, working with clients, how beneficial it has been for me to be able to partner with their mental health professional and to be able to, if I'm feeling stuck, I'm not sure why my client's not progressing, that it seems like they're not able to follow what we're trying to do, or they're really hitting barriers on this.
Yeah.
Or they have some kind of mental block about what we're trying to do, to be able to go to their provider, make sure both that the provider understands what we're doing, and the provider can help give ideas of how do they apply what they're learning with their mental health provider, how can they
Yeah.
apply that in the training with you. um, in my case, I've gotten permission from that client to talk to their provider and them together.
Yeah.
That's what's been the most comfortable for me rather than talking to them separately.
Right.
That's
But
really cool.
Absolutely.
Yeah.
that's been
Yeah.
so helpful. And I've had cases where the provider really didn't understand what the service
Mhm.
dog was doing. And I've seen people where the provider is telling them, well, you're using your dog as a crutch. I don't want you to use
Mhm.
that dog. I want you to actually work on working,
Yeah.
through your symptoms and to help
Yeah.
them understand how the dog is actually part of working
Yeah.
through
Right. It's that
Yeah.
experiential component that we're
Yeah.
absolutely talking about. And I'm
Um,
really glad you brought that up, Jen. I think
mhm.
that, again, that comes down to that provider education piece. And,
Yes.
every client is, and for our clients listening too, like every client's going to have a different comfort level with, do I want my trainer to talk to my mental health professional? And when you go through a release of information, which is that formal
Mhm.
way of documenting that we've agreed like that this is okay, like the client feels like it's okay, you can absolutely specify, what you want that person to know. And as mental health providers, Michelle and I can speak to the fact that we are guided under certain laws, and so we
Yes.
we only share the bare minimum that we feel like really needs to be
Mhm.
shared. And so
Mhm.
hopefully, other licensed professionals, it would be the same way with them too. But that gives
Yeah.
a little bit of reassurance to clients who may be like, oh, I don't really know. But I think you do have to have a lot of trust in both your trainer and your mental health
Mhm.
provider in order
Yeah.
to take that step. And when it does happen, it can be extremely beneficial.
Yeah.
But it may not be that everybody's at that comfort level, and that's okay
Right.
too.
And I
Yeah.
think for me as the trainer in one of these cases, the client had been bringing it for a while that she thought it'd be beneficial if I talked to
Mhm.
their provider. And I was struggling with that, feeling like that was invasive.
Hmm.
And ultimately, it was me hearing and seeing some where we were like, okay, let's talk together. And the release was for individual sessions. And so that made me more comfortable to kind of not feel like I'm stepping in a world or taking something from her being invasive in a way that didn't feel comfortable to me by her being present and it being these isolated times. Then I could see how it made such a difference in our progress. It gave me such understanding and let her provider reinforce her and her kind of plan with her of the areas that I saw she was struggling that he didn't see because he wasn't out in the field with her. And so it initially I really resisted it as a trainer the first time I was in that position. And now I welcome it.
I
'Cause
can imagine, like,
Mhm.
from, if I didn't have a mental health background from a trainer perspective, that would feel a little scary too, right? It's like
Yeah.
you don't really know
Yeah.
what you're stepping into, like, what territory is this? Like, what are the boundaries there? And, those are questions that if a trainer is listening and you're like, I'm not so sure about this, that's why we have a lot of support within Atlas, and we have,
Mhm.
team facilitator meetings and trainer meetings. And you can utilize myself and Michelle and Jen for support
Mhm.
when you have these questions. So
Yeah.
if you're thinking like, well, I just don't know, or it seems like foreign territory, just to know that's really normal to feel that way. And
Yeah.
we all
Yeah.
start there, even as therapists, like we started there where it was like,
Yeah.
this is all just things that we're learning together.
Yeah.
And I think when we're taking like a holistic approach, like it really does work so much more beautifully than, when there are just like separated parts. But
Absolutely.
yeah, but if there
And
are questions, we're here to support and help as
yeah.
well.
Yeah, and we're really passionate about the education piece for other clinicians too. And I know there's a part of me that gets frustrated hearing when clinicians can be really resistant or they just aren't maybe educated in what a service dog is, what a psychological service dog is. We hear, I've heard a lot like, well, use the words like using as a crutch, or I want you to be cured or healed, or whatever those words really mean when we're talking about trauma. We know that healing is non-linear, whatever those words might mean to you. And what's important is the goals can be different for everyone, whatever recovery versus curing, or things can be chronic. And it's different for each person. So when we have clinicians that might have that viewpoint, well, hey, this dog might be a crutch, or I want you to have no symptoms. Oh, let's look at what the client goals are, the person's goal in front of us, and their realistic or maybe their lifelong ebb and flow of symptoms. And the core is, and what we have found and research does back up and support when it comes to the research on like veterans and the use of psychological service dogs for veterans, is that there is a great benefit and a great reduction of these symptoms that are causing disability. But at the core, each person's therapy goals and each person's living goals and how they want to navigate life and treat and accommodate their disability is going to be different. So I know Sarah and I and Jennifer, we are always open to speaking with people about any concerns clinicians might have, just educating about what a service dog is, how it can be incorporated in care, treatment ethically, how potential clients can speak or talk to their mental health providers or their clinicians about breaching that subject, because it can be very, very scary to talk about and advocate for what you feel could be a good course of treatment for you. And while service dogs and psychological service dogs are not a cure, neither necessarily is a guarantee for any intervention that any clinician does, or any doctor does, or any. So we got to keep that in perspective too. And I had a really good advice from, wasn't necessarily about service dog, but a doctor that I saw for chronic health issues, and I was really frustrated. And they were like, "Look, keep pursuing whatever makes you feel better and able to live life." And that just kind of opened up this self-permission that's like, yeah, I do deserve to keep pursuing what makes me feel better, and like I can work and do what I feel like I need to do in my life and live my value-based life.
I love that. I think that is so valuable. And I think too, I like to think, I don't even know if I really like the word healing sometimes. I believe like
Right. Yes.
we can
Whatever that
have
means.
degrees of healing, but I think
Yeah.
that, overall as people, like I don't really know if there's anything such thing as being cured, right? We're
Right.
always having a human experience and it's always
Mhm.
getting usually more complicated rather than
Mhm.
less. And so as
Yeah.
the more we're normalizing that, hey, we each have this human experience. Living your best life is the goal, right? Like
Mhm.
living a life that feels fulfilling to you, where you're,
Mhm.
free from like over anxiety and depression and going through some of those really difficult symptoms. I think like that is sort of like hopefully the overarching goal when you're talking about mental health is just being able to live a life that feels comfortable and that feels fulfilling. And I believe that that's accessible to everybody and that's going to look very different from one person to another. So I think really, painting that picture for providers especially is important, or, sometimes it might be in the workplace too, which I know we haven't
Mhm.
really talked about that, but that could be an issue where, client wants to be able to bring their psychiatric service dog to work. And maybe there are, people within the organization that aren't really understanding that. Well, how can we have conversations around that, right? And how can we approach, people in those situations that maybe they're not even really thinking like from a clinical
Mhm.
standpoint, like a provider might, but maybe they're thinking from a standpoint of like, well, what about the welfare of the organization? Or like, is this just going to make everyone want to bring their pets in? Which,
Right.
I would say, sure, yeah, like they're not pets, but, um,
Or the
but
flip side,
yeah.
I've seen, especially like right now with the economy tight, layoffs happening,
Mm-hmm.
and having coached many clients on how to
Mm.
approach people bringing their dog to work, being scared that it will impact their performance reviews, being
Yeah.
scared they'll be fired,
Mm-hmm.
um, not wanting to disclose that they have a disability to their employer.
Mhm.
Um, so that
Yeah.
there's can be a lot of stress around that too.
Yeah. Yeah, and that's a whole like knowing your rights, knowing that's a whole can and a half of things. But Sarah, yeah, those are all really good points. And Jennifer, that's a really great point of just the complexity of when it's a personal choice to decide to bring on a psychological service dog or having a service dog in your treatment. I guess I don't know how in your treatment plan that you have. It really is a personal choice, and what might work for you might not work for somebody who is just like you on the outside diagnosis, but it wouldn't work for them. And so, and it's something that can change too. So something in working with clients who disabled clients who have a service dog, and maybe they decide, what, it doesn't actually fit for me. It did for a time, but now it doesn't. Like that's the beautiful thing about incorporating different kind of accommodations for your disability and treatment is it's never concrete. It can always change and grow and move with you as whatever we want to call it, healing or um, uh, whatever we want to call it. It can always change with you.
And I think it's important to recognize with that, to your point of maybe it's not the right fit, that
Mhm.
having a service dog is not necessarily the right fit for everybody.
Right.
And if you don't have a dog with the right temperament and the right
Mhm.
personality or fit to do the work, that can greatly increase your
Yeah.
anxiety
That's a really
and
good point too.
really increase your burden of functioning. And you really want to
Yeah.
think about, is this the right thing for me?
Yeah.
Either right now or in this location, or with my
Mhm.
present condition or my present support system. Dogs are fluffy neon signs
Mhm.
that something's going on with you. This can be really good for some people with invisible disabilities and really bad for others.
Mhm.
And they're a lot of work. You
They're a
no
lot of
longer
work.
have a quick
Yeah.
5-second run into the store to grab something when you have your dog that you need to open the door and get leashed up and help them get out and let them go to the bathroom and then get in the door, make sure nobody's messing with them, and then finally go, now why did I come to this store? To continue on. So I think, that's not really the focus of this, but just recognizing they may not always be the right answer for you. And I think one
Yeah.
thing I wanted to bring up real quick, because I saw that was on one of the questions that people ask, and maybe ask one of you to talk about this too, is what about the dog? What about the stress the dog feels
Mm.
from their
Mhm.
person going through trauma?
I think that absolutely goes back to that goodness of fit, right? And some dogs are not going to be suitable for this type of work. And also, to kind of back up a little bit, I think we're also alluding to the fact that a service dog isn't forever, too. So when you're getting a psychiatric service dog, knowing that eventually there is going to be some transition and some grief process that you're going to go through, too. And that could feel like I don't want to say a setback for a lot of people, but it is something else that emotionally are going to have to process. And so that bond can be super close and can be very special. And that is actually something we're going to give a talk on later this year, is talking more about, the grief and transition from one service dog to another, or just from a service dog to not having a service dog anymore.
Mhm.
But I think that's a great question that somebody asked. I think that we have to be able to assess, the dog's stress signals. And if you're not a trainer who maybe has a little bit of a background in behavior, as a client, there are lots of valuable resources on understanding stress signals in dogs. And when you're going through Atlas's program, we give some scaffolding around that as well. As what do those stress signals look like? And what does it look like for your dog? Because every dog is an individual. So some dogs are going to show stress, and then some dogs might get more shut down. It might be a lot harder to see. I think those are the situations that are actually the hardest, because people think maybe the dog is fine when the dog is actually shut down or maybe not wanting to work. So that is a really good question. I don't think there's really one clear answer to that, other than we have to keep our eyes open. We have to keep
Yeah.
assessing. And that honesty, I think, can be probably the hardest part about training service dogs, is, being honest about that piece and saying, is this the right fit for the dog?
Yeah.
How much of this work do they really enjoy? How do
Yeah.
I know they're enjoying it? And also, what other parts of their life are enriching to them, and making, sure that they have a full and enriched life, and they have time off, and they're able to do dog things and engage in dog behavior, right? So I
Yeah.
think that's a really valuable question that person asked.
And I
Yeah.
think it's
And
something that I know a lot of clients really struggle with,
yeah.
especially if you have, say, an attachment disorder, or depending on your mental health condition, if your dog is, instead of coming to you to help you, is now avoiding. And to
Yeah.
not take that personally, to not blame the dog, to not say, oh, we just need more training, but to
Yeah.
recognize this is the dog opting out. And the
Yeah.
dog has to be allowed to opt out and recover.
Mm.
And looking at how do you manage that yourself?
Mm.
How do you make sure the dog has those times that Sarah talked about, that are their times off and times they get to make choice? What other tools do you have for yourself? But to recognize that psychiatric service dogs work because of empathy,
Mhm.
Yeah.
and
Yeah.
it's wearing on the dog too, and
Yeah.
that we can do great harm to our dogs without realizing it, and to not take it personally if
Wow.
they just can't, like, people wouldn't question it. Oh, a mobility dog can't carry something for 10 miles, but somehow they're
Wow.
expected to carry our emotional burden for 10 years.
Wow.
So recognizing they need to get to say no, and we need to help give them then that support and look at what else do we do differently? Where do they get those breaks? So I think that's something it's really hard to see in the moment when
Yeah.
you're having a panic episode or you're really struggling. You're like, I
Mm-hmm.
just want my dog to come and do deep pressure. I just want them to do what I train them to do. They know how
Yeah.
to do this. They know what they're
Yeah.
supposed to do. And instead the dog may be there for a minute and then backs off.
And I think
Yeah.
leaning into those
Yeah.
conversations with your trainer too, I think is really important. And, that's why it's important to have, open communication with your trainer, not even after, you've passed, a test
Mm-hmm.
and you're done. Like it's still really important to keep having those conversations. And, if you're wondering, is my dog doing okay? Like pulling your trainer back in and saying, hey, what do you observe here? Because they could help you and maybe provide some insights as well. And sometimes it's very hard for us with our own dogs, in any capacity to be very objective, right? It's
Yeah.
really hard because you're
Absolutely.
with them a lot of the time, especially service dogs. They're with you
Yeah.
so much that sometimes picking up on those really subtle cues of not wanting to work or being tired, that could be really hard for someone who is with their dog all the time. And, I can speak to
Yeah.
that not from a service dog, but working with therapy dogs. It's very
Yeah.
similar in knowing that, hey, this dog is with me all the time, so I may not
That's a really good
recognize some
point.
of these things. I might not be seeing it.
I really love this discussion because I feel like as we learn more as just a field, like this training field and just how dogs' empathies work, like I feel like 10 years ago, I don't know if this was as talked about. And so I love hearing those considerations of like, yeah, the dog needs to have opt-in and choice and the example of mobility, walking for 10 miles, carrying something versus 10, this emotional load that they have. And something that when I'm talking with clients, like my clinical clients, about coping skills. And whether it's an ESA or we're talking about psychological service animals, I talk about like if our whole like everything is weighed on the dog, like I have to have this dog, and if I can't go with this dog, I'm like I have to have them. That's a lot of pressure for the dog, and making sure that you have backup plans. Well, if we can't have the dog because they're sick or they need a day off or they're opting out because, as you guys just explained, man, it's been a lot and maybe the dog's just not feeling well or just needs that break. Being able to have something to have backup, your coping skills being
Absolutely.
very deep. Just the mobility, you would have mobility aids, but same with like psychological service dogs, we'd have psychological aids or coping skills. And so having a mental health provider or peer support or somewhere that you can go to talk about these really heavy things that training a service dog or being a part of that, it can be very heavy. And like we just talked about the different changes, I know thinking back, yeah, it's very stressful. And having someone that I could talk to about those times when my dog was sick or during the transitional stages of not having a service dog anymore and maybe going to train another one and all of that. It's very, very important to have as much support as possible and to not put all your eggs in one area of coping skill.
Well, I recognize we're getting close to the end of the hour. Um, what, and this has been a heavy topic, but also one that I think is really important. And I think, Sarah, you brought up, I really liked what you brought up of saying everybody has the capacity to regain or have fulfillment in their life. And it may look really different. And it may be what someone's goal is of being, it may not be being able to be completely anxiety free in all situations, but maybe it is in a few core ones that really matter to you. And so just recognizing that, I think both you said this really nicely in the blog that there is hope. And
Absolutely.
yeah.
Absolutely.
So I don't
Yeah.
know if
And I
there's
think
anything you guys
too,
want to close on there.
yeah, absolutely. The only other thing I would just like to highlight again is just knowing for both trainers and clients, there's no such thing as too much support.
Right.
Support can look different, from what one person to another, like what kind of support they need, but just knowing it's okay to grow that community of support, whatever that looks like, because that kind of piggybacks on what Michelle is saying is, you don't want, everything to just be on having your psychiatric service dog. That there are other pieces and other things that can be really value added and helpful to you as well. So cultivating that support, and there are some resources in the blog as well for support if you wanted to look and further that. But also, if you're wanting more information, anybody is welcome to reach out to us, and we can obviously give more resources and very well resources on the therapy and the training side. So we're happy to help.
And I did put the link to the blog in the FaceTime Live. And also anybody who's on our newsletter would have gotten a copy of that. And this will be recorded and available as well. Cool. Well, thank you all for joining us. We hope this was educational and interesting and helps you on whatever aspect of this is in your journey. All right.